Welcome back. Hive Health recently raised $6.5 million in pre-Series A funding in a bid, of course, to transform healthcare access for SMEs across the country. Now, among the key investors, we see family-backed Gen 3 Fund, BNext, and other notable names like Y Combinator and AmAsia. Now, joining us in the studio for more are the women behind the digital health insurance brand, Camille Ang and Jiawen Tang. Ladies, welcome. Good to see you again.
Yes.
Yeah, great to see you again.
Okay, we're checking out since the last time we met on another show on ANC. Maybe you can tell us first about Hive Health, what it is, what it does.
Yeah, so Hive Health is a full-stack digital health insurance company that provides higher value, easier to use plans, specifically for small, medium businesses. So a lot of the offer that we provide to SMEs is much higher value in terms of the benefits that they have. The network that they not only have the offline doctors and hospitals, but we bridge it to online care as well. And the most important thing is they're able to avail it. And even when you have just a basic plan, it's easy to avail and go to your doctor anytime you need it.
Joan, anything you'd like to add?
Yeah, we mentioned in terms of what we've been up to since we last spoke last fall. You know, actually a lot has changed. I think last time we spoke, it was right after the acquisition of our HMO partner, HPI. And so, you know, the past couple of months, we've really been focused on integrating the systems as well as the 20,000 provider network across the country. And you know, in the past year, we've actually 8x'd our revenues, and there's really exciting momentum and traction in terms of being able to impact more and more SMEs across the country.
All right, you have a lot of things going for you, one of which, of course, is the pre-Series A funding, which you just got. Congratulations. Tell us a bit about what it is and the kind of boost that it gave your morale, considering that, you know, a pre-A series is something that's given to new businesses where they see great potential.
Yeah, I can take that. I think we're really, really grateful to be able to, I think you mentioned some of our investors, to partner with them. I think for us, it's not just about capital, but having people who can support us and really believe in our mission. So BNext, for example, already invested in similar companies across the world, such as Nigeria, India, US, that have been successful. So we're really excited to bring them in our journey as well. Gen 3 is affiliated with a third-generation C family, so we have the shared interest to invest in the Filipino economy. Y Combinator launched Airbnb and Dropbox, Uber, so we really want to build a really meaningful business. We also have like other angel investors that joined us in this journey, including the ex-CFO of Netflix, the former CEO and owner of HPI, the company that we acquired, and the founder of QualiMed, which is a healthcare provider network that's now with the QualiMed Healthway network. So I think we're really excited to have these partners to journey with us, and we're also excited for what it means in terms of where it will bring Hive to the next level, and that is in a couple of fronts. First is we're hiring a larger team, so really excited.
So really getting bigger, huh?
Yes, in terms of our like really, really hardworking and mission-driven superstar team to grow that multiple times. We're also excited to, I think I mentioned before that we have already a nationwide network through the acquisition, but we want to reach more municipalities, more provinces, the most remote areas in the Philippines, and partner with more providers. And lastly, we want to invest in our product. So it's not just the tech, but also the different parts of the operation to make the member experience better, make the provider experience better, and really change health outcomes for more Filipinos.
In the course of Jiawen, in the course of you know your conversations with the investors, what did they like most about the product, and what potential perhaps did they see that you can perhaps share with us?
Yeah, sure. So I think what investors really like about our product is that it's solving a real pain point. It's a real problem in the Philippines as well as other developing countries all over the world. We're solving the ability to access quality, affordable healthcare, and especially for the SME segment. And if you think about it, we have a B2B2C model where there's HR managers and small business owners that are just trying to run their business, but need to attract and retain talent. So how do we make it easy for them to enroll, understand the plans, enroll members, and really manage the care for their team so that they don't have to think about it. But then the C component of B2B2C is really for the patients, for the employees and their dependents. How do we make their care really, really hassle-free from the entire care journey, from the moment that they become a Hive member to the first time if they ever need to find a doctor through our app, to if they're not feeling well, they can book a teleconsult, to God forbid something happens and they need to go to inpatient care, where it's really about thinking both in terms of how we're solving a real problem and how we are very much focused on we've demonstrated that we've continuously iterated on a solution that is getting greater and greater traction and getting great feedback from the
about that B2B to C that you mentioned. I think a lot of small, medium enterprises realize the value of offering a health product for retention and even talent acquisition. But how much traction do you think are you gaining with the SMEs? What has the campaign been? How has it been in the past year? How do you let them know that your services and your products exist?
Yeah, sure. So we actually haven't spent on any paid marketing ads. So we've been very fortunate, and it's been a mix of word of mouth, referrals from very happy customers and clients, and referring other businesses in their network, as well as really being part of really making it easy to understand. So you can go to our website, our hivehealth.com, and we make it very clear what are the benefits, how does it work, and you can actually click a button to request a proposal, whether to talk to us or get the proposal itself. And we really want to make things very transparent. Like, health insurance is so complicated. There's so many benefits. So what's included, what's not included, and we're really trying to demystify it and be as transparent about not everything is covered, but we have done a lot of competitive benchmarking to make sure that we provide the most value for money, the most suited plan that we can in the market, and that's what that's what we're continuously trying to improve on.
And speaking of value added, and speaking of sulit, and speaking of these services that are not known to be offered by regular health plans, you offer a host of packages. You have the LGBTQ plus partner packages, and then what else? How are people reacting? How's the market reacting to these features?
Yeah, I think in terms of the reaction, I think the word of mouth and referrals really say a lot. Just the other day, my uncle was saying he was speaking to a stranger who was reiterating all the features. So from a member perspective, it's much easier for them to book a teleconsult, see a doctor. In terms of the length of the time that you have for your letter of authorization, it's also longer. In terms of for the employers and HR, they're able to better understand where their money is going to, and that's really meaningful for them. In terms of the package that we have, it's a comprehensive health plan package, but we do have a lot of the benefits that your standard health plan doesn't have. Mental health is super important, out-of-pocket, outpatient medicine, for example, and we've become more intentional about who is able to join a health plan versus what is status quo in the market.
Okay, speaking of being intentional about who gets the health plan, on the provider side, I've seen exponential growth, if you will. It's 1,700 partners hospitals, and maybe thousands of even medical practitioners. Tell us how else do you intend to grow that number to reach more in the provinces, particularly?
In terms of providers, or in terms?
Providers.
Yeah. So we're fortunate, through our acquisition with HPI, that we've really started with a nationwide network that's actually as large as the largest HMOs in the country. But really, it's then about building a differentiated network to make sure that whenever a Hive HPI member shows up, that the providers understand what that means and understand what benefits are covered. And so there's actually a lot of interesting tests and innovations that we're exploring in terms of, for instance, directly integrating with certain clinics so that we can actually eliminate, for instance, if you want an annual physical exam or go to one of our special accredited dental traditional clinics, you actually do not need a LOA, a letter of authorization. You just click a few buttons in the app and then select what time you want to go to whichever clinic, and you can proceed. So thinking about how do we continue to eliminate paperwork, admin hassle, and then integrating with providers to get more data around the medical records and storing it for patients, and then finally making our platform and having the data be very transparent for the providers. So we provide more transparency and faster payments to all of our providers as well.
I think that's a major pain point for a lot of health services, health insurance services. Now that you're getting the funding, you're getting the support, I'm sure I can only begin to imagine how that would accelerate a lot of your goals for the next couple of years. If you can tell us, how do you intend to spend all that financial support?
Yeah, I think.
Where will it go?
Yeah, I think I touched a little bit on it a while ago, but we've mapped out the team that we need to be to add to be able to grow in terms of not just like the number of people, but also in terms of like the value that we provide. And yeah, the second piece is really investing in the different product features to make processes a lot smoother for like members. And I think bending the cost curve for healthcare health financing is really important, because if we're able to reduce, build all these efficiencies to cut out the overhead, improve underwriting, we're able to give that back in terms of healthcare accessibility.
What about digital platform? That is, of course, one of the expense points for a lot of businesses. How much of the funding do you think would go to the platform? Yeah,
I think we see ourselves, our origins was really like a tech company, and now we're both like a tech company and a healthcare insurance company. So as a percentage versus the market, we're probably a much larger percentage. So a big part of that will be invested in the tech platform, but we're very conscious also in building our provider network. So the last quarter alone, we added more than 600 new providers, and we just onboarded a new team to accelerate that even further.
All right. Something that's worth sharing is the story behind Hive Health. Can you walk us through the experience of what it's like coming up with the idea and getting it into fruition? How did you guys start?
Yeah, I think we mentioned last time that we were friends first. We met as classmates at a dual master's program at Harvard and Stanford, and we actually worked on this from a public health master's thesis perspective to really understand what are the problems in healthcare, like why is out-of-pocket costs over 50% in the Philippines, and then narrow down into how can we actually shrink the change in doing our part and trying to be a part of the overall healthcare ecosystem. So Camille and I actually started this during the pandemic on Zoom, trying to talk to anyone who would be willing to talk to us. And I remember when we first flew over to Manila, since we were in grad school in the U.S. When we first came to start, it was during Y Combinator, so it's a Silicon Valley startup accelerator program, and we really very much were staying up late because it was at California time to meet with the partners there. But then during the day, we would be talking to customers, talking to providers to really understand the pain points, and it very much started from a dorm room back in the day, and now we're really growing our team and really trying to expand our impact. So yeah, it's from 3 years ago. It was an idea. Then we launched a pilot.
Now it's a reality.
Now it's a reality. Pilot. We did the acquisition, and now we have really grateful for the fundraising support to now really accelerate and scale our impact.
And was the concept always tailored for the Philippines?
I think I had a personal bias because I grew up in the Philippines, but when I met Jiawen...
But I think it's the same situation in a lot of, at least Southeast Asian countries, where healthcare insurance is still a challenge.
So I think our go-to-market is the Philippines, but we definitely want to expand our market and touch more lives beyond the Philippines. In terms of, was it always the Philippines first? I think when I met Jiawen, we both realized that we went to grad school to be able to develop something at scale and really meaningful for developing countries. And the macros of the Philippines, is really
Perfect.
amazing. We have a rising middle class. Our insurance penetration is really low, but after the pandemic, there's a growing awareness for higher quality health plans, especially among SMEs because of talent retention. Like people now know that health plans, quality health plans are table stakes to be able to keep your employees happy and really attract good talent.
And lastly, guys, what's the future like for Hive Health?
Yeah, we have a lot of exciting things lined up. The first is, as Camille mentioned, we are looking to build our team. So anyone who's interested, please visit our website. You can click on careers to see our open roles. Second, as you mentioned, the provider network is really the heart of making sure we can give care to our patients. So it's continuing to improve that network, build a differentiated network and interesting ways of partnering with providers and delivering care. And then finally, on the technology side, in terms of being a digital platform, we're doing a lot of interesting investments in building, using data to both improve the way we're servicing clients and hopefully provide even more SULIT plans in the future.
Yeah, and to build on what Jiawen said, I think when we started Hive Health, the North Star was always to increase healthcare accessibility, and we see it in 4 different fronts: improving financial coverage, improving population coverage, so more people having it, and improving service coverage as well. So all these benefits that are not available, and the 4th piece is service. But right now we're focused on the processes, making things more efficient and providing higher value from an insurance point of view. But what's really exciting is a lot of these value-based care and being able to change health outcomes. So in the Philippines, we have a lot of diabetes patients. There's interesting population health statistics that we're really excited to move into the next phase of actually managing that care and working with providers to be able to incentivize patients to take care of their health, improve their health, and as a result, that helps their employers as well because their spend on high health surgeries, for example, will decrease. So we've seen that in a lot of countries, and we're excited to bring that in the Philippines.
Yeah, pretty exciting times, both for the Philippines and Hive Health. Again, Camille Ang and Jiawen Tang, Hive Health, thank you so much for joining us this morning.
Thank you so
for
much.
having us.
Great day.